Hello, welcome back to my YouTube channel. How are you all? I hope you all had a good time. And for those of you who are seeing me for the first time, I would like to say this is Rocha, and I have been making different videos on nursing related subjects, especially I had done some videos on psychiatric nursing. Currently, I'm making some videos on nursing research, especially in exam point of view. And if you have gone through my previous video was about research designs. And today I would like to share with you all regarding a very important topic, true experimental research designs. This has been asked from several years. Every year a question comes from this topic. So it's a very important in exam point of view. So let's just see what is true experimental research design, especially in nursing. What are different types of experimental research designs? If we see, we have three experimental research designs. Among that, first one is true or classical experimental research design. We have pre-experimental research design and quasi-experimental research design. So either they come as an essay question or a 5 marks question, but every year a question comes from this. Either from sometimes like from true experimental research designs, we get like one group pre-test, post-test, or sometimes Solomon group research design. It comes as a 5 marks question. We will just go in detail about these research designs. Some of the elements which are involved in true experimental design is manipulation, control, and randomization. You need to have an understanding about these words. What is meant by manipulation in research? Manipulation is nothing but some changes which are made by the researcher in the research while conducting a research. Whoever is the researcher, he makes some changes in the environment where he is going to conduct research. That is called as manipulation. Why does a researcher do manipulation? In order to find out or in order to get the findings, results, what he wants. Sometimes he may manipulate the environment, change the setting. For example, easy example I'll tell. If a researcher or if someone wants to conduct a study on effect of temperature on students' mindset while listening to the class, maybe he can manipulate or change the temperature, increase the temperature from 25 degrees how student reacts and to 30 degrees how a student reacts. If the classroom temperature is 35 degrees how a student reacts, the level of their concentration and attention can be measured, their reactions can be measured. Suppose at 40 degrees level how the students react or listen, how effective the class would be. So here manipulation is done by the researcher where he changes the environmental settings purposefully. He does. I hope you got the meaning of manipulation. These are three elements are very important. Unless you have an understanding of this, you cannot proceed further. You will not understand any designs like. Next one is control. What is this control? Here, this is also done by the researcher. When he wants to conduct an experiment, the researcher tries to control certain variables like extraneous variables. True experimental research design, he controls some variables which are not involved in the study. And apart from that, when we say control group, they are taken as a benchmark or a reference to compare with the experimental group. There are two types of controls, what I am telling here. Generally, controls means like a researcher controls certain extraneous variables in true experimental design so that it will not affect the study. That is one thing. When we say control group, it is a group which is used as a reference where an experiment is not done, but it is used as a benchmark to compare the experimental group with the control group. This is another meaning of it. Next, coming to randomization. When we say randomization, here samples are picked randomly. That means every subject has an equal chance or an opportunity to participate in the study. For example, because we use this randomization word frequently in experimental design, I would like to just explain it with an example. Suppose there are 100 students in a class and we want to conduct a study, and the sample what we want to take is 25 students, for example. How do you pick the 25 sample? You can write a slips like 1 to 100 slips, put in a jar and pick up randomly 25 slips, and whosoever number is there, maybe you can take that student, isn't it? So here 100 students, whoever are involved, might have an equal chance of getting involved in that study. That is called as randomization. Every subject might have an equal opportunity to get involved in the study. So this understanding these three elements in an experimental design is very important, as we are going to use them and compare them. Now coming to the some of the true experimental research designs, just the same thing whatever I have explained, control over extraneous variables. So controls two types I said. One is a control group, that is different. And another control is control of extraneous variables, those variables which are not involved in the study. Next point, observed effect on dependent variable is only due to manipulation of independent variable. A variable which is not subjected to any change, we call it as independent variable. A variable in which we notice some changes, we call them as dependent variable. Consists of all three elements of control, randomization and manipulation. In what? True experimental research design, all these three elements are present: control, randomization and manipulation. Three types of experimental designs are commonly used in nursing, and we are going to discuss about those. First one, pre-test, post-test, control group. Pre-test, post-test, control group. Okay. Next one is post-test only control design. Post-test only control design. In this there is no pre-test. Solomon 4 group design. So we are going to see regarding these designs in detail. First one, pre-test, post-test only design. Pre-test, post-test only design. Coming to this design, we have random assignment of what? Samples. Random assignment of samples. Samples are the participants who will be involved in the study. Sample is a subset of the population. Samples are the participants who are involved in the study. So, for example, in pre-test and post-test only design, sample might be 100, and among that we can take experimental group as a 50 and control group as a 50. This is an example I'm telling. Like if you can take 200 or 300 according to the study what you're doing, you can divide it. So what happens in an experimental group? Pre-test is conducted. When we say pre-test, before the treatment, pre-test is conducted for both experimental group as well as control group. And in experimental group, treatment is given. And after the treatment, post-test is conducted. In control group, we said it is a reference point. There is no treatment for control group. It will serve as a benchmark to find out what change has occurred. It will help for comparison of the post-test results. So here in control group, they are not going to give any treatment, and post-test is done without any treatment. Suppose, for example, you want to find the effectiveness of nebulization among patients suffering with pneumonia or asthma or respiratory problem. You have taken two groups, like 50 sample here and 50 sample here. You conducted pre-test here. Pre-test might be their breathing pattern and x-rays, etc., vital signs you have taken, or some questions about like deep breathing exercises, whatever it is, whatever questions you want to assess, like during your pre-test, or however you want to assess regarding the important aspects related to the respiratory or lung capacity, you can involve them in the pre-test. And the same criteria can be used in the post-test as well. You can prepare a questionnaire format, take their vital signs, assess them, how they are, and their breathing. You can take an x-ray, then write the findings over there. The two groups might be suffering with respiratory problems. The treatment, what you wanted to give is effectiveness of nebulization. So in experimental group, you are going to provide nebulization. And in control group, they also might have been under treatment with some different medications, but here we are not going to give any nebulization to them. After a certain amount of period, it may take 1 week or 2 weeks, it is according to the researcher. Post-test is done on both. Whatever questions or whatever measurements or tests which are done during the pre-test, the same will be repeated in the post-test. Pre-test values and post-test values will be compared and checked if there are any changes or improvement in the condition of the patients involved in the research. In experimental group, apart from that, these interpretations are compared with the control group, which makes our research more stronger. Way of proving that nebulization is effective when given to the patients who are suffering with some respiratory problems. That is how you try to prove it. So I hope you got an understanding. Pre-test, post-test only design, it includes experimental group and control group. Control group, no treatment, but experimental group, we give treatment. And pre-test and post-test are common for both the groups, experimental as well as control group. Next, coming to another design, post-test only control group design. So post-test only, this word itself, post-test only, that means what is not there here? Pre-test is not there. There are two groups here, experimental group is here and control group is here. But what is not there? Pre-test is not there. And study sample is selected in what, on what basis? Randomization, random assignment, because these are experimental studies. Now coming to the treatment part of it. Experimental intervention is present here. No intervention or placebo. Post-test is conducted. So pre-test measurements are not there. As I said earlier, we take pre-test some measurements, vital signs or blood tests or respiratory capacity, whatever it is. Whatever the researcher wants to measure, it depends upon what the researcher wants to measure. So this is like post-test only control group design. Next, coming to important, very important one. Asked several times in exams. Solomon 4 group design. This is a very, very strong research, true experimental design. Here, random assignment of the samples. And the samples are divided into 4 groups. Experimental 1 group, actually 1 group and 2 group. So under 1 again we have experimental group and control group. Experimental group and control group. Suppose a study is done on 100 sample where 50 and 50. Among this 50, experimental group we take 25, control group you take 25, and experimental group 2 you take 25 and control group 25. Now whatever we have seen before, the previous 2 research designs are combined, you can say. They are combined. In one group, pre-test, post-test, control design, you have seen this experimental pre-test is conducted here, treatment is given, post-test scores are compared here. And apart from that, in group 2, experimental and control group, pre-tests are missing. What is missing? Pre-test is not missing. There is no pre-test here. Only treatment is given and post-tests are done. And the results are compared from group 1 to group 2. And results are compared with experimental group with control group 1 as well as with experimental group 2 and control group 2. So when we do this Solomon 4 group research design, it provides a strong base. In nursing, we use this, where we can show that our results are reliable. They have validity. So these are the 3 important research designs. I hope you understood. Any experimental designs, you need control, manipulation and randomization. Randomization is related to selecting the sample. Control group, where there is no intervention done on the control group, but it is used as a reference point or a benchmark where we can compare with the experimental group. Experimental group is one where a treatment is given, pre-test and post-test scores are compared. And experimental group is also compared with the control group to show its reliability. And in Solomon 4 group, it is mostly used, and it is a standardized experimental research, true experimental design, where when we do these experiments, we can rely on them. So these are the three important true experimental research designs. Next we'll move on. Okay, some of the advantages and disadvantages are here. Advantages are most appropriate for testing cause and effect relationship, most appropriate for testing hypothesis. Disadvantages: ethical considerations for human subjects. Whenever we do experiments on humans or lives of an individual, like, ethical considerations are very important. We have some principles to be followed, like confidentiality, privacy, doing no harm for the life of an individual without their consent. Consent is very important. Then decide pre-test can affect post-test response, because when we conduct pre-test, it gives a clue to just respond in the post-test. That is one disadvantage. That's the reason in experimental group, like Solomon 4 group, in the group 2, we have no pre-test. Only treatment is given and post-test response is noted. Now coming to quasi-experimental research design. Here when we say that quasi itself, it's pseudo. So at least one element misses from that of true experimental research design. It involves manipulation of independent variable. Manipulation of independent variable. When we say independent variable, actually it is not subjected to any change. That's what it means. But in quasi-experimental research design, manipulation of that is done by the researcher. And lack of one characteristics of true experimental research design. So at least one element will be missing. Either randomization will be missing or control. One will be definitely be missing. So coming to like a test, it also tests cause and effect relationships. So either any of that will be missing, but some of the elements will be present, like either randomization might be present, or sometimes control might be missing, or control may be present, randomization may be missing, manipulation of independent variables is present. So some of the designs which are involved here, like we have non-randomized, non-equivalent control group design. So here the sample will not have equal chances. That means objectivity sometimes might be missing. Then we have another one called as time series research design. Coming to non-randomized control group design, the other name for this is non-equivalent control group design. Identical to pre-test post-test control group design except randomization. No random assignment of subjects in experimental as well as control group, very common in nursing research. So here you might have been understanding like it is similar to that of true experiment, but what is missing here? Randomization is missing. The randomization, we have sampling techniques like random sampling techniques, but that is not there. Sometimes we can take convenient samples, whomever the researcher feels they are convenient or available at that period. He can just select the sample and do the study. And control group and the other aspects are the same, like pre-test, treatment, post-test, but samples are not randomized. Advantages and disadvantages: more practical, feasible, suitable in nursing research, establish causal relationship, then no control over extraneous variables. But whereas in true experimental research design, we said there is a control. where the researcher sets sets a setting where extraneous variables are not involved. The setting will be arranged in a manner that there would not be any involvement of extraneous variables to the maximum by the researcher in true experiments, but whereas in quasi experiments this aspect misses. Lack of control over research setting, that's what it means. Next, coming to one more research design, that is time series research design, which is used in quasi-experimental. Time series research designs are recently being used in nursing research. Here, for example, actually before and all, time series research designs were used like for comparing any stock markets as the time passes by from previous year to present years, how the changes have been occurring, or previous months to present. It involves period. When we say time series, it involves a period. How nursing has made its transformation when compared to previous 5 years or 10 years, how the changes have occurred. This is like time, when we use this word time series research design, it takes certain events which have occurred in specific times and compare how the progress has been made or a deterioration occurring, how the things have deteriorated from these many years. You can compare like that. Now coming to the other research design, pre-experimental research design. In this design, actually it is considered as a very weak design where the researcher has little control over the experiment. So under this we have two research designs, one shot case design, and one group pre-test and post-test design. So just you have an idea of what we have discussed. One group pre-test post-test design, that means what? Only one group is there. On that group we are doing pre-test and post-test. There is no control group. That itself gives you an answer, isn't it? Then one shot case design, single experimental group, no random assignment of the subjects, no control group, just an experimental group is there, single experiment, and it is done. One shot case design, that's it. Experiment, treatment, and post-test. No pre-test also. Next, one group pre-test, post-test. Simplest type, only experimental group is they present. There is a pre-test and post-test. No control group is present here. You have to compare this. When we say one shot case design, experimental group, there is no pre-test, only treatment and post-test. But when we say one group pre-test and post-test design, there is a group which is not randomly selected. There is no control group. Extraneous variables are also not controlled. But pre-test is there, treatment is there, post-test is there. Pre-test results are compared with the post-test. So, some of the advantages and disadvantages of this test. Like very simple, convenient, suitable for the beginners. Very weak experimental design, selection bias will be there because there is no randomization. Mostly whichever sample is convenient, the researcher picks that sample and conducts the test. High threat of internal validity. Next, coming to other research designs used in nursing, outcome research design. So when we say like it is outcome based, when we try to do some intervention on the patient, we try to see whether there is any outcome. It's similar to that. Whatever nursing care we provide, we want to look at the outcome. if there is any improvement in the patient. So outcome research is the same. It involves care practices and systems to develop evidence-based practice. Evaluation studies. It is about the success of the studies, procedures and policies. So these are different types of research designs which are very important when you want to become, when you want to conduct a research, you need to have an idea to select which research design you want to go for. If you are doing any interventional studies on any on the public or any patients or whatever it is, you have to be very careful in selecting the research design, and as ethical a committee is there which needs to approve, and you need to see that different types of principles, legal aspects also, ethical principles need to be followed. So the most of the students at BSc level use this quasi experimental research designs, and when we go for the master's level and the PhD levels, it is always preferred they go for true experimental research designs, or according to the whatever you want to just show or add to the nursing profession, you want to prove something, it's according to that you select a research design. So I hope you have understood this research designs, and next class we will just go ahead with the other qualitative research designs, and I just want to give an overview. Exam point of view, qualitative research designs are also very important. Sometimes they might be asked for 5 marks or 2 marks questions as well. So we'll just gather in a short period of time. I hope this video will be very useful for you all. Thank you all very much, and please do subscribe and share. Apart from that, please do comment. I really don't know whether you want me to explain to you in Telugu as well. If anyone wants me to explain in Telugu, and if you find any difficulty in understanding, please to put a comment so that I can understand whether you're able to catch what I'm telling or not. Thank you all very much. We'll meet soon. Bye.